Good afternoon, viewers. Myself, Dr. Rohit, PG scholar from Department of Basic Principles, GMC Mysore. Welcome you all to TATVAPRABODHINI Day 4, a national webinar series on Ayurveda for COVID-19, organized by Government Ayurveda Medical College, Mysore, in coordination with Vishwa Ayurveda Parishad. So, welcome you to the 7th scientific session. Today's topic is Chikitsa Sutra of Jwara vis-a-vis COVID-19. And today's speaker, Dr. Sidaram Malleshappa Guled. Sir was born in 13 May 1983 at Yarnad, Basveshwar, Basavan Bhagewadi, Vichapur, Karnataka. Sir finished his undergraduation from BLD Ayurveda Mahavidyalaya, Vichapur in 2007. Sir finished his post-graduation from Government Ayurveda Medical College, Mysuru in 2010. Teaching and clinical experience. Sir started his career in 2010 as a lecturer in Shri JGCHS Ayurveda Medical College, Kataprabha from 2010 to 2013. Then Sir joined SDMT Ayurveda Medical College, Therapeutic in 2013 and worked as a reader in Department of Kaya Chikitsa. Presently, Sir is working in Government Ayurveda Medical College as assistant professor in PG, UG and PG Department of Kaya Chikitsa. Sir has presented many scientific papers in national and international seminars. And Sir has delivered guest lectures, awareness speeches, and conducted many free health camps. Achievements. Sir was awarded for securing first rank in BMS by Private College Association, and Sir was awarded for his work in the field of Ayurveda by Rotary Club Jamkhandi. Sir, field of interest are understanding and implementation of Samhita and practice. I welcome you, sir, for today's scientific session. Over to you, sir.
Thank you, Dr. Rohit, for your introduction and welcome. Respected dignitaries and all the organizing committee members and all the members who have joined online YouTube webinar series, I welcome you all. Today's my topic is Jwara Chikitsa Sutra with special reference to COVID-19. Coming to the introduction, Jwara is one such disease where all the three faculties of the body, that is Deha, Indriya and Mana, are being afflicted, so that if it afflicts the Deha, it causes Santapa. If it afflicts the Indriya, it causes hampered functions of the senses. And Mana, which causes the Vaichitya Rati and Glani. So Dehendriya Manastapo Sarvaroga Grajopali. That makes it grievous that it is aggravating all the Vadis. The Swabhava of the Jwara is it can take severe form, leading to the debilitation, serious complications, and even end up in the death. So it is necessary that early and proper treatment according to dosha, avastha, kala prakarsha, etc. can save the patient. Understanding newer fevers, the presently SARS-CoV-2 virus, H1N1, chikungunya, dengue, etc. and treating them according to Ayurveda is a challenge. Fundamentals of Jwara Chikitsa Sutra definitely give insights to understand and treat COVID-19 also. Jwara Chikitsa Sutra is complete, extensive, precise, and stepwise, and I can say that there is no shortcut in some instances to treat Jwara. Okay. With this short introduction, I will move on to the topic proper. Before you begin to treat, know about it or know about the Jwara. So the Acharya says that Rogamado Pariksheta Tato Anantaram Aushadha. So you first investigate the disease and know about it, then start with the treatment. So some of the basic information required before you begin to treat are Hetu, whether it is a Nija or Agantuja, and details about them. You need to know about the dosha, whether it is a ekadveshaja, doshaja, vidoshaja or sannipataja. And we need to know the dosha also, rasadi dhatu, sandhi involved. And we need to know srotas involved, that is pranavahadi srotas that are involved. Avastha of the Jwara with which the patient is approaching you, that is most important. According to Avastha only, the Jwara chikitsa has been mentioned. Whether the patient is coming to you with Ama, Pachamana or Virama Avastha. And we need to know Bala and Sadhya. Next, we will understand some more details about these basic things we need to know. First one is the Hetu. As we say that COVID-19 is a virus and it is an external factor which is going to enter into our body. The one which enters into our body from the external is called as the Agantuja. So going to the details of that, there are 4 types of the Agantuja Jwaras are being mentioned. Abhighata Abhishanga, Bhyam, Abhichara Abhishapa. Certainly it is not an Abhighata, Abhichara and Abhishapa. So what left is the Abhishanga. There is variety of causes are being considered under the Abhishangaja Jwara. So one of that is Bhuta Abhishangaja. So Bhuta, the real meaning of the Bhuta is the living creature. Any living creature that enters into the body is called as the Bhuta Abhishangaja. So Bhuta, which is also includes the microorganisms which are going to enter into our body, and it is also called as Grahavesha or Grahapada. Coming to the dosha involvement, it is said in the Bhuta Abhishangaja that Triyo Malaha Bhuta Abhishangat Kuppenti Bhuta Samanya Lakshana. So the tendency of Bhuta Abhishangaja Jwara is it can involve the all doshas. It is a sannipataja. And after knowing the Hetu, the dosha's involvement by the Hetu, and we will know what exactly in the present COVID-19 symptoms, what doshas are going to be involved. The most, this is I have taken it from the WHO and I tried to assess the dosha assessment. The most common symptoms observed in COVID-19 are fever, dry cough and fatigue. The fever is pitta, ushma pitta date nasti. Dry cough, that is vata, fatigue, that is because of the vata. So the symptoms that are less commonly seen are the loss of taste or smell, which can be attributed to vata kapha, the nasal congestion, which can be attributed to the vata, conjunctivitis, we will attribute it to the pitta, sore throat that can be attributed to kapha pitta, headache, muscle or joint pain can be attributed to vata. The different types of the skin rashes are also going to be seen, which can be attributed to pitta and rakta. Nausea, vomiting in some cases, which can be attributed to kapha. The diarrhea can be attributed to pitta. Chills or the dizziness can be attributed to vata and kapha. In some of the cases, symptoms of severe COVID-19 disease are going to include shortness of the breath, which are because of vata kaphatmaka vedo pittasthana sambandha. Loss of appetite, that is because of the kapha. Confusion, vata. Persistent pain or pressure in the chest, vata, even though it is a avanajanya vata, but still we consider vata. High temperature, so the tikshna dwara or trivra jwara is because of the pit. So the symptoms presenting in COVID-19 are suggestive of Sannipata dosha involvement with vata kapha predominance in early stage and vata pitta predominance in the later and some conditions. Let us know these srotas in part. As the Sarva Roga and Sarva Sharira is going to involve in the Jwara, there is a possibility that many of the organs are going to be involved and many of the srotas are going to be involved. The Pranava srotas, there is a presence of Pratishaya, Kasa, Swasa in the COVID-19 patients. Definitely the Pranava srotas is going to involve. Looking at the Aruchi Chardi that are observed in COVID-19, that can be attributed to the Annava srotas. And the skin eruptions, chest pain, myocardial infarction, coagulopathies are heading towards the Rasaraktavaha srotas involvement. There is rarely involvement of Mutrava srotas also seen, that is the coagulations are also seen in the Mutrava srotas. Studies also showing that multi-organ damage in COVID that suggest probability of involvement of the other srotas also. We need to know the avastha. So the total avastha of the Jwara, the total chikitsa of the Jwara is dependent on the avastha which the patient is presenting. The main avasthas are Navajwara, Pachamana Jwara and Jina Jwara. The method of understanding the avastha is the days, that is Navajwara 7 days from the onset of fever, Pachamana Jwara from 8th day to 12th day, and Jina Jwara after 12 days. It is said by the Pushkalavata that आसप्तरात्रं तरुणं ज्वरं माहु मनीषिणः मध्यं द्वादशरात्रं तु पुराणं मत उत्तरम्. And it is should not be only depend upon the days, because the days may be very varied. Avastha should be confirmed by observing their lakshanas. The ama, pachamana and pakvajvara lakshanas are to be seen, and accordingly the avastha should be explained or understood. In COVID-19, apart from infection, the coexisting health issues of the patients are very much essential. The status of the Agni, dosha vitiation, dosha dhatu vitiation, kavai gunya, and coexisting diseases, and the apatya the patient has consumed before and after the affliction of the COVID-19 are very much essential in knowing the avastha of COVID-19 patient. And avastha is also important in deciding the progresses and prognosis of the infection. And we also need to know bala and sadhya sadhyata, baladhishtanam arogyam yadartho yam kriyaka. Person with adequate strength is considered as healthy. Treatment is done to restore the strength. The treatment itself means the restoring the strength. We must be cautious while administering the Langanadi upakramas that are mentioned in the Jwara, like Shodhana and Langana like upakramas. Bala plays an pivotal role in the treatment of any disease, not only in COVID-19 or Jwara. In any disease, Bala plays an important role. Now, the Chikitsa Sutra, the all varieties of Chikitsa types, Vikti Vipashaya, Daiva Vipashaya, and Sattva Vijaya are being extensively used in the treatment of Jwara. So, giving more importance to Yukti Vipashaya because it is Drishtafalavat. So, it is Drishtapala, so Yukti Vipashaya has been given a more importance. So, in Yukti Vipashaya, Navajwara Chikitsa, it is divided into Navajwara Chikitsa, Pachamana Jwara Chikitsa, and Jirna Jwara Chikitsa. And even the Acharya has separately explained Sannipata Jwara, Vishama Jwara, and Dhatugata Jwara Chikitsa. Even though the basic principles for these other Sannipata, Vishama, and Dhatugata Jwara remains the same as in Navajwara, Pachamana, and Jirna Jwara, but some special considerations are to be taken while you treating these three Jwaras. Now coming to Navajwara Chikitsa, before going to it, Navajwara Varja, the first sloka, the Chikitsa referred to the Navajwara Varja, what are to be avoided in Jwara. Navajware divasapna sanabhyangana maitanam krodha pravata vyayaman kashayamascha vivarchayet. Divasapna snana abhyanga gurubhojana krodha pravata vyayama and kashaya need to be avoided. These are individually capable of increasing and exacerbating the ama and causing the dosha vitiation. So one of the point I want to stress here is Kashaya is being contraindicated. So what is Kashaya? Kashayam to Panchavida Kashaya Kalpana. We should not go by the decoction here. It is about the Panchavida Kashaya Kalpana. Any Guru Aushadha need to be avoided in Navajwara Chikitsa. And coming to the Navajwara Chikitsa Sutra, it says that Langanam Svedanam Kalo Yavagvaha Tiktako Rasaha Pachanani Avipakwanam Doshanam Tarane Chur. Avipakwanam Doshanam Tarane Chure Pachanani. So the Pachana is the core point we need to consider here. So because of the ama doshas associated in Jwara, the Pachanas are most important. That is all about the Navajwara Chikitsa Sutra. The Pachanas included in Navajwara are Langana, Svedana, Yavagu, Tiktarasa Pana, Kala, and even Vamana is also considered. So these are the Pachanas useful in the Navajwara. We go one by one. The first one is the Langana. Langanam atra upavasaha. Langana is referred as upavasa, only upavasa here. Leaving other 11 types of the Langanas, only upavasa has to be considered. And it should be used Langanam eva ado upadishtam. So Langana is the first line of management before going to any Jwara. So it need to be carried out until Samyak Langita Lakshanas are observed. It is said that Langanam Langanena Kshayam Nite Doshe Sandukshite Anale Vijvaratvam Lagutvam Cha Kshutchayvasya. It should be advocated till Dosha Kshaya happens, Agni Sandukshana happens, Jwara comes down, Deha becomes Lagu, and Kshuddha has to be increased. This is Kshuddha is the main important Lakshana we need to observe in advocating the Langana. How to do this? What is the vidhi? Prana avirodhana chayinam. We should not harm the life of the patient. So baladhisthana margyam yadartho yayam kriya. So due consideration of strength is mandatory during the Langana procedures. So the question comes, does COVID-19 need a Langana? This is most important. The guidelines is given in the Samhita itself. It says that Shuddha Vata Kshaya Gantu Jirna Jwarisu Langanam Neshate. Langana is not needed in the Jwaras which are because of Shuddha Vata Kshaya Agantu Jirna Jwara. Langana is not needed. But along with infection, if coexisting conditions of Koshta, Agni, Ama are in favor of Ama, so there may be required the Ama. Otherwise, we may not need Langana in COVID-19. It may require in Annavasrotas involvement, like in COVID-19 patients, Aruchi, Chatti, and Atisara are going to be frequently seen. In such conditions, Langana is to be needed. So then, what to be done if Langana is not needed? What to be done in Agantuja causes? Teshu hi hitam shamanam yanna karshanam. There, you need to go for the shamana without doing the karshana. A lot of apatarapana therapy is not indicated in Agantuja causes, so you should go for the shamana therapy. Go for shamana modality, provided you should not do the karshana. Another avastika chikitsa is mentioned as vamana. It is not a compulsory treatment or the mandatory treatment. If at all you are going to observe in any of the Navajwara patients, Kapha Pradhana Klishta doshas, which are doshas are situated in the Amashya, and they are Atyanta Prakopita and ready to come. They are ready to come out of the Amashya. Then only if the patient is Vamana Arha, you can go for the Vamana. Otherwise, it is not an needed treatment. Then coming to Jalapan, so as we are giving the Langana here, the patient will acquire the Trishna. So what to be done if the patient with Trishna is there? We cannot go for the normal water. It is said that Trishyate Salilam Choshnam Dadyat Vataka Fajjare Madhyote Paitike Chata Shitalam Tiktakaihi Shitam. So the Acharyas have divided the Jalapana into points. One is Ushna Jala, another one is Shita Jala. The Ushna Jala should be given in Vataka Fottara Jwara, and Shita Jala should be given in Madhyaja and Pittaja Jwara. So can we give a normal water? It cannot be given normal water. It is Tikta Kaihi Shita. We need to process the water with Tikta Dravyas, which are Pachaniya and Jwarahara Tikta Dravyas. Then you cannot give it as a Ushna Jala itself. You process it and then you allow it to cool, then it should be given. Okay. So the famous and very important yoga, that is Shanangapaniya, is on the basis of Madhyote Paitike Chata Shitalam Tiktakai Shitam. That is itself is popularly known as Shadanga Pani. It contains Musta, Prapataka, Ushira, Chandana, Udicha, and Nagara. Except Nagara, all other 5 drugs are Tiktarasa Pradhana, and they should be given. And it should be given in Pipasa Jarashante. So how it is going to help? Jalapana, how it is going to help in the Jwara rogi? Deepanam, Pachanam, Chaiva, Jwaragnam, Ubhayam Hitat, Srutasam Shodhanam Valyam, Ruchisvedakaram, Shiva. Looking at the functions of Jalapana, it is going to work on total samprapti of the Jwara. It is Deepana Pachana, it is Jwaragna, it is Srutashodhana, which is seen in the Jwara samprapti. Even Ayush guidelines for COVID-19 has included Ushna Jalapana, and it is being extensively practiced now. Now, coming to the another Pachana Vidhi in Navajwara, that is Svedana. Svedana is not compulsory in all the Jwaras, but in few cases where it is needed, it has to be taken up. And then it is mentioned that Sodarda Pinasa Swase Janga Parvasti Shulini Vatasleshmatmake Svedaha Prashasta. If the Jwara Rogi presents with Udarda Pinasa Swasa or Janga Parvasti Shula, then we need to go for the Svedana procedure. So, what is Udarda? Udarda we usually refer to as the skin manifestations, but in the Arunadatta has given a beautiful explanation about the Udarda. He says that Udardaha Ukto Vakshobhishandaha. So, Vaksha Abhishanda. What is Abhishanda? Abhishandam Shandayati Srotamsi. There is a secretions in the srotasis, so making it congested and obstructed. So this Abhishanda is going to happen in Vaksha. Vaksha we refer to the Puppusa and especially the lungs. The congestion in the lungs is to be considered as Udarta. Some other meanings are also there for the Udarta. They are Shita Vepatu or Shotaha Raga Kandu Itu Aparai. Somebody will tell that it is a Shita Vepatu or it is a Raga Kandu Yukta Shota. So as they are mentioning respiratory related symptoms here, Udarda Penasa Swasa, better we will consider it as a Vaksho Bishandaha. The congestion in the chest, Penasa and Swasa, we need to go for the Sweda. And in purely Vataja conditions like Janga Parvasti Shula, in such conditions we can go for uh, the Svedana procedure. Suitable variety of Sweda is to be selected according to the patient's condition. For example, Valaka Sweda in Sandhishula and Shota, that can be taken up. Guru Pravarna Ruksha Svedana in Shita Purvakajura. Kutishveda is being mentioned by Charaka. It can also be taken up. It will bring Agni Vriddhi, Samyak Pravritti of Sveda, Vata, Mutra and Purisa. It is said that Doshanam Apravartanam is the Samprapti that is going to happen in Amajura. So Samyak Pravritti of Dosha like Sveda, Vata, Mutra and Purusha need to be taken to avoid the long-term complications of the Elitra. So another important pachana is mentioned in Navajwara is Yavagu Pan. What is Yavagu? Yavagu Bahusikta. When we boil the shali with jala, more amount of jala, after cooking the shali, so if the liquid quantity taken along with the sikta, that is rice, cooked rice, is considered as the Yavagu, isn't it? So Yavagu in as an Nakalpana. So when we need to give it, so Kshuda appears after Langana, Vamana and Svedana, then only we have to give the Yavakupan. So still Guru Aushadhi and Guru Ahara are still contraindicated because of Agnimanda and Ama here. Lagu Ahara, which is also Aushadha, is to be administered. So Yavagu is one such Annakalpana. It's a complete blend which can be indicated in Jwara, which acts in Jwara as well as a Ahara Bhava and Jwara. Variety of Yavagus are mentioned according to the varied presentations of the Jwara. According to the presentation of the Jwara, we need to go for the Yavagu Pan. So, Yavagu, there are many Yavagus are being considered. Now I am going to tell you Yata Saushada Siddhapi. How to prepare the Yavagu is Yata Saushada Siddhapi. What are Swa Aushada? The Jwara is going to present with Kasa. The Jwara may be going to present with Swasa. It may be going to present with Pratishaya, Mutra Kruchra, Atisara, Chardi. There is varied presentation is there. Accordingly, the medicines, those helpful in those associated complaints, those to be taken, they will be processed with jala. In that jala, the Yavagu should be prepared. So how it is going to help? It is going to help because in the form that it is Tashagnir Deepate. So Agni Deepana is going to happen by this. Trit Prashantaye. So the proper hydration is going to maintain. Ahara Bhavat Pranaya. It will give the prana as the Ahara Bhava. And then Joragnaha. Not only this, it is Vyadhi Pratyanika also here. So it is Joragna in nature. So and it is Jwarasatme also. It is wholesome to the Jwara Rogi. So that is the reason why Peya Abhiraditaha. It should be started with Peya Abhiradita. Some contraindications are also there. And there are n number of Yavagus are being mentioned. I'm not going to all of those Yavagus. Only few, 3-4 I have selected that can help in COVID-19 cases. If the Jwara is alone, that can be given with Lajapayam, Sukajaram, Pippali Nagara Ishatam. So the Lajapaya, which is prepared with Pippali Nagara processing, that can be Jwarahara, Kshudvan, Alpa Agni Raditaha. It can be given in any kind of the fever. So that it will be Sukajara and it is Agni Deepak. If the patient presents with Atisar, so if the patient presents with Atisar, what should be done? Amla Bilashitameva Danimamlam Sanagaram, Srishtavit Paitiko Vata Shitam Madhuitam Vivek. If Srishtavit and Pittaja Jwara it is there, then you go for the Lajapaya, prepare the Lajapaya, which is processed with Nagara, Pippali, and then add the Madhu in it after making it Shita. And if the patient presents with Parshavasti Shiroruji, so the pleurisy or the pleuritis, what we are frequently seeing in the COVID-19 patients. So in such cases, the Peya prepared with Peyamva Raktashalinam, Parshavasti Shiroruji, Sudamstra, that is Gokshara, it is a well-known diuretic, and Kantakari, which is well-known drug which is used in the respiratory system. With these two drugs, we can prepare the Yavagu that can be helpful in Parshavasti Shiroruji. And then in Kasi Swasi Chahikicha. So if the patient Jwara presents with Kasa Swasa, go for the Shutam Vidarigandha Dehi Deepanim Swedanim Naraha. Prepare the Yavagu with Vidarigandha Dravyas. That will be helpful in Kasa and Swasa. If the patient presents with Jwara and if the patient presents with chardi, that is also seen in nausea and vomiting in the COVID-19 patients. So in such conditions, go for the yavagu, which is prepared with Sita Badara Mrudvika Sariva Mustavat Chandanai Trishna Chardi Paridaha Jwaragnim Kshaudra Sammutam. So this yavagu can be used. And coming to the Tiktarasa Prayoga. Tiktarasa Prayoga is one of another type of the Pachana that is mentioned in the Navajwara. In the form of Shadanga Paniya that can be given. Dravyas used in the preparation of Yavagu may be used with the Tiktatrasa Dravya. Shakas like vegetables, the patola, kara, velaka, etc. And the Kashaya preparations which are made with Tiktatrasa Dravyas in the further treatment of the Jwara, they can be made use. Kashaya Rasa is contraindicated in Navajwara because of their dosha stambhana property. And now, after completing, by this time, what happens by Navajwara chikitsa? So, ama doshas are going to come down. So, there may be only some amount of ama may be remained or no ama may be remained, and then only the doshas are going to be remain. Okay. So, now going to the Pachamana and Jeenajwara chikitsa. So, Kashaya, we cannot be carried by decoction here. Kashayam tu Panchavida Kashaya Kalpanaha. So, Swarasakalka Kvata Himapanta, that is being mentioned. So, those to be considered as Kashaya here. But the acharyas have indicated only the Kvata, Hima, and Fanta. So, you can prepare these Kvata, Hima, and Fanta even in the Pachamana Jwara for the Jwara Rogi. So, there are two types of Kashayas here, Pachanam, Shamani, Va. So, the Pachana Kashaya should be used even after the 7 days of Navajwara Chikitsa. If Samata is still remain, so then go for the again Pachana Kashaya. If the Ama is being completely treated, if only Nirama doshas are there, go for the Dosha Shamana Kashayas. There are n number of Kashayas are being mentioned according to the dosha involved, the cause involved, and the presenting complaints of the Jwara Rogi. There are many Kashayas are being mentioned. But some common Kashayas which can be used, any variety of Jwara I have taken up here. So, Pakyam Shita Kashayam, the Kashaya refers to Pakya, that is Kvata. Shita Kashaya refers to that which is prepared at the night and kept, and it can be used in the other day. So, that is called as Shita Kashaya. So, Musta Parpatakam Pibe, the Kashaya prepared with Musta Parpata, Sanagaram Parpatakam Turalaba, and Kiradatiktam Musta Guduchi and Vishwabeshija, or else the Kashaya prepared with Patham, Mushiram, Sudishcham, Pibedva Jurashanti. These can be used. These are the Pashana Kashayas. They can be used in any variety of the Jwara. So there are some Kashayas which can help in Sannipata Jwara. So associated with Upadravas. Usually Sannipata Jwaras are associated with the Upadravas only. So because of the severity of the doshas. So if the Sannipata Jwara associates with the Upadravas, especially their respiratory complications, what Kashayas need to be used? It is said that Sannipata Jwarapaha Kasa Hrudgraha Parshvati Swasatandrashu Shashyate. If the Sannipata Jwara presents with Kasa, Hrudgraha, Parshvarti, Swasa, and Tandra, go for the Kashaya prepared with Shati Pushkara Moolam, Vyagri Shringi Duralaba, Gudichim Nagaram Patam, Kiratam, Katukarani Rohini. So that is Shattadiko Varka. The first line, that is Shati Pushkara Mula, Vyagri Shringi, and Duralaba, are very much useful in the respiratory system. And Guduchi, Nagara, Pata, Kirata, and Katukurovini are very much useful in the Jwara. So this is a perfect blend of which is Sannipata Doshahara also, and it is Upatravahara also. So another such Kashaya, that is Sannipata Jwarapaha Kasadishu cha Sarveshu Dadyat Sopadravish. In Upadravas like Kasadi, the Kashaya prepared with Brahati, Kantakari, Pushkaramula, Barangi, Shati Shringi Duralaba, Vatsakasya Bijani, Patolam Kadurohini. So this Kashaya can prove beneficial. So it may prove beneficial in COVID-19 with respiratory involvement. And I will take some Kashayas which are specific to Vishamajwara. So there are 5 Kashayas are being mentioned here, each one for each of the Vishamajwara. The Shamana Kashayas, respectively beneficial in Vishamajwara, specific to Dhatu involved. Conventionally, these are known as Dhatapachaka Kashayas. So why I have taken this Vishamajwara here is, a particular dhatu is being told in each variety of the Vishamajwara. So in any of the infectious conditions, if these dhatus are seen to be afflicted, go for these Kashayas. In Santata Jwara, Rasa is involved, so that Kalingaka, Patola Patra, and Katukuroination should be used. In Satata, Rakta is involved, Patola, Sariva, Musta, Pata, and Katukurovini Kashaya should be used. In Anyaddushka, Meda is involved, Nimba, Patola, Triphala, Murdvika, Musta Vatsakau. Tritiyakam, that is Kiratiktam, Amruta, Chandanam, Vishwabeshijam. Chaturtakam, that is Gudichamalakam, Mustam, Samajvara, Jarapaha. So, according to the Dhatu involved, you can go for the Kashayas. These Kashayas can be used in any other fevers, any infectious fevers by knowing the Dhatu involved. For example, in viral hepatitis, Rakta Dhatu is involved. We know that liver and gallbladders are going to involve. So, Kashaya prepared with Patola, Kadukuroini, Sarva, and Musta, which is mentioned here, they can be used. So even the Charaka mentioned Patola Katurana Kasha, which is including the same content in Kama. So these are the only two chikitsas, that is Pachaniya Kashaya and Shamaniya Kashaya in Pachamana Jwara. So after this, by the time if you reach the Jirna Jwara Chikitsa, so the ama is going to vanish. Then even because of the Apatarpana Chikitsa, even kapha also going to come down. So now you have a condition that Ata Urdhvam Kafe Mande Vatapittottare Jware. No ama is there, kapha is manda now. Then what remained is Vatapittottare, Vatapitta are remained. Paripakveshu doshishu, no ama, Sarpishpanam Yatam. Go for the Sarpipan. What it will do? It will do the Shamana of Ruksha. So because of Langanadi Upakramas, the Agni is also going to become Ruksha here, isn't it? Because the Snigdhata is the quality of Pitta. So that Snigdhata has been reduced, the Agni has become Ruksha. So to do the Shamana, Kritapana is essential. So Ruksha Sharira Snehana, it is Balakara, Vata Pitta Shamana, and it can also become Kapha Shamana by Samskara. So one of the Grata I want to remember here is Amrita Kantakari Grata, which is mentioned in Swasakasa, that can be utilized. And then another Jirna Jwara Chikitsa Sutra is Kshirapana. The same indications are there as in Gritapana. Daha Trishna Paritasya, Vatapittottaram Jwaram, Baddha Parchita Dosham Va Niramam Payasa Chayat. So one of the Kshirapaka I want to remember here is Kasat Swasat Shirashula, Parshashula Chirajwara, Muchate Jwarita. In post-COVID conditions, if still the patient is associated with Kasa Swasa and Shirashula and Parshashula, go for the Pitva Panchamuli Shritaha Payaha. Panchamuli Siddha Kshirapaka can prove beneficial in COVID patients in a long term. And then after the Gritapana and Kshirapana in Jirna Jwara, Sodhana are being mentioned. They are Vamana, Virechana, and then Shodhana Basti, Anuvasana Basti, Nashyakarma, and Rakta Mokshana. They should be used cautiously and according to the condition. And I want to consider one Antarparimarjana here, that is Nashya, that can be used in COVID-19. So whether it is a COVID-19 or any disease, the Nashya should not be used in Navapratisha. So as we are having Navapratisha and Navajwara and Pakvajwara, in the same way, in Pratishaya also we are having Navapratisha and Pakva Pratisha. So now Nashya is indicated only in Pakva Pratishaya, not in, so we should not use in whenever there is a sneezing and post-nasal drip and such conditions are there, we should not go for the Nashya. And it is advocated only in Jirna Jwara. It can be used in the later conditions of the COVID-19 also, because the loss of sensation is very much persistent in the COVID-19. So that it is said that Indriya Prabodhanam, the Nashya can bring the Indriya Prabodhana, that is Indriya Prabodhana brings the normal sensory functions of the Indriyas. So it can bring normal actions of the Indriyas. After Antaparimarjana, even Bahiparamana Chikitsa is also being mentioned in the Jwara, which are the Abhyanga, Parisheka, Pradeha, Avagaha, Dhuma, Dhupana, Kavala Gandusha, Anjana. I'm not going to the details of them. Only I have to consider some of the things which can be beneficial in COVID-19. So Dhupana, Navana, and Anjana in Agantuja Jwara. So Dhupana, Navana, and Anjana are mentioned in Agantuja Jwara. It is said that Dhupananjana Yogaihi Yanti Jirna Jwarashamam Tung Matra Sheshache Bhagant Agantru Anvaya. When Agantru Anvaya is there, go for the Dhupana and Anjana. So one of the Dhupana mentioned is prepared with Palankasha Nimbapatram, Vachakushtam Haritaki, Sarshapaha Sayavaha, Sarpir Dhupanam Juranashana, Ye Dhuma Dhupanam Chechan, Avanam Cha Anjanam Chayat, Manovikare Nidishte Karyam Vishamachure. So even those which are mentioned in the Manovikara, Umada and Apasmara, those Dhupanas, Dhumas and Navana Anjanas mentioned there, they can also be made use here. So Dhupana is indicated in Grahadosha and Bhutabhishangaja conditions. Dhupana even indicated by the Sushruta in Vrinitopasaniya to avoid the secondary infections as a sterilization procedure. Keeping so the first barriers for the any infectious disease are the skin, eyes, mouth, and the nose. So keeping them strong and healthy is the first barrier you can avoid the infections, and even secondary infections also you can avoid. So keeping Bahimada Srotas healthy and strong with Dhuma, that is nose, mouth, throat, even trachea, Dhupana, that is skin, Anjana, that is eyes, and Navana, that is nose, can be made stronger so that can avoid further contact of the Akantu causes. And then Dhuma, Gandusha, and Kavala, they can be used at any conditions of the COVID-19, and even they are included in the Ayush guidelines for the Ayurvedic management of the COVID-19. धूमगंडूष कवलान् यथादोषं च कल्पयेत् प्रतिशाय आरस्य अश्ववैरस्य शिरश्शूलः घण्टामयापहान्. They can be used in Pratishaya, Asyavirasya, Shirashula, Kanta, Amen. They are very much prominently present in the COVID-19. They can be used. It can be advocated in COVID-19 because above presentation is observed here and can be used at any stage of the disease. And Sannipada Jwara Chikitsa Sutra, I said that Navajwara Chikitsa remains the same for even for the Sannipada Jwara. So this special consideration has been made after whenever the Sannipada Jwara is going to continue in the Pachamana Jwara or Aqua Jwara, then only some changes are need to be taken. Otherwise, the total treatment for the Sannipada Jwara also remains the same. There are two conditions are there in the Sannipada Jwara. One is Vishama Sannipada Jwara, another one is Samasannipata. It is easy to treat Samasannipata Jwara compared with Vishama Sannipata Jwara. So we need to make Vishama Sannipata Jwara to Samasannipata Jwara first. That is, you increase the decreased dosha so that it comes to the equal to the other dosha. You decrease the increased dosha so that it will come to the less increased dosha. So that completely you first make it Samasannipata Jwara. Then in Samasannipata Jwara, first treat the kapha, that Kaphasthananupurvyava Sannipata Jwaram Jayet. The line goes as the Kaphasthananupurvyava Sannipata Jwaram Jayet. Once you made all the doshas equal, go for the Kaphasthana and Kapha Chikitsa, later Pitta, because Pitta Adrite Nasti Ushma, and then go for the lastly Vata. And Navajwara Chikitsa remains same for even for the Sannipata also. So after completing this Jwara Chikitsa Sutra, some complications with COVID-19 I want to take up. The first one is the swasa, that is breathing difficulty. So can we adopt swasa chikitsa in COVID-19 with breathing difficulty? It is said by the Acharya that Toramanena chikitsa. Whenever a upadrava becomes dreadful than the actual disease itself, becomes dreadful even than the pradhana roga itself. So go for the treatment of the upadrava along with the treatment of mukhya roga. So swasa chikitsa need to be advocated in COVID-19 with breathing difficulty. So the treatment mentioned here is the svedana, especially the uraha and prushta sveda. Hikka swasarditam snigdairado svedairupas pacharet attam lavanateilena nadi prastara samkare. This is a simple procedure. Take the oil, especially the Brahad Saindava Taila, Mahavishagarbha Taila, added with the Saindava. Go for the application and massage over the chest, neck, and the back. Then followed by the any of these Nadi Prastara Sankara Svedas. What happens by this is Tairasya Kritita Sleshma Srota Savivilyate. The Gratida Sleshma is going to become liquefied, the Sotas is going to be emptied, and the Sotas are going to become the Mardava Mrudu, so that the spasm which is there is going to be calmed down, and then proper Vata movement is going to happen there, so that making the patients of the any Swasarogi ease in respiration. And even Mukha Svedana is also mentioned. It is widely practiced in COVID-19 presently, and it is proving beneficial also. If at all after Svedana, if Shesha doshas are there, go for the Dhuma, Linasya Shesha doshaha, Dosha Sheshaha, Sha Dhumai Hitam, you can go for the Dhumapana also. And then after these two procedures, Dhuma and Svedana, Vata Kaphara, Snigdha Anulomana, and Swasahara Chikitsa need to be adopted. And many of the COVID-19 patients presents with Jwaratisar. A separate chapter is being mentioned in Chakradatta, that is Jwaratisar. In the Chakradatta, it is mentioned that Jwaratisare Peyadikrama Ashat Langite. So what should be need to be done? I was telling that In Agantu Jwara, no need of Langana. But when the patients of even COVID-19 also presents with Jwaratisara, we need to go for the Langana here. Langite, go for the Langana, then go for the Peyadikrama, that is Yavagadi Upakra. So one of the Yavagu that is mentioned in Jwaratisara, Jwaratisari Peyamva, Vived Samlam Shutam Naraha, Krishnaparni Bala Pilva, Nagarotpala Dandaki. You can go for this treatment. The Langana is the first treatment, Peyadikramas, and what medicines or the Kashaya should be given? The Kashaya should be Pachana Sangrahi. Don't go for the Sangrahi or the that is what we call Sangrahi or the Stambhana Dravyas. Don't go for the Sangrahi Stambhana Dravyas. Go for the Pachana Sangrahi Dravyas. It means it will does the Pachana of the doshas and it will do the Graha or Sangrahi. So some of the Kashayas mentioned as Ushiradi Kashaya, Patadi Kashaya, and Guditchayadi Kashaya in the Chakra. That can be made utilized here. And another important and more fatal in COVID-19 is the coagulopathies and its complications in COVID-19. The majority of the deaths due to COVID-19 are because of the coagulopathies. The mechanisms involved in coagulopathy in COVID-19 are enhancement of the coagulation and weakening of the anticoagulation and fibrinolysis are the two mechanisms leading to coagulopathy. And what is the pathology? Damage of vascular endothelium and extrinsic tissue factor leading to inflammation. Inflammation is the main culprit or the pathology which is going to happen in the vasculature. Then what it leads to? It leads to deep vein thrombosis, pulmonary embolism, ischemic strokes, and then myocardial infarction, renal artery thrombosis, and systemic arterial events that are the serious consequences of the coagulopathy. So what are the present strategies in the modern to manage the coagulopathy? Anti-inflammatory therapy. That is the reason why extensively the steroids are being used nowadays in the management of COVID-19 with coagulopathy. So, and then anticoagulant therapy is used, heparins and other antiplatelets are used, and even blood purification systems like plasma exchange and other things are being used. But it is said that anti-inflammatory therapy is equally coagulation therapy. That we have to keep it in mind. That is the article is there for the reference. Then how to understand this? Actually it is a challenge. So how to understand this coagulopathy in Ayurveda, especially in Jwara Rogi? The connection we can get in Jwara and Rakta Pitta. So I am trying to explain it here. Jwara Samprapti due to excessive Rakta and Pitta Dushti may take the form of Rakta Pitta Vyadhi leads to bleeding disorders. Okay, it is said that Tat Santapad Rakta Pittam or Jwara Santapad Rakta Pittam Udiret. So Jwara is a Nidhanarthaka Roga for the Rakta Pitta. It is said in the Rakta Pitta only that Pitta Dushta Rakta, when severely afflicts with Kaphavata Dosha, it leads to Gratita Rakta, that is clot. That is called as coagulation. Samsustam Kapavatabhyam Kante Sajjati Chap. So what treatment we can give here is Rakta Prasadana, Pitta Shamana, and then it should be Pitta Rakta Shamaka. At the same time, it should be Vata Kapahara also. How to plan this? Because when you go for the Pitta Shamaka, we should use the Shita Kriya. When you use Shita Kriya, it becomes Vata Kapha Vruddha, isn't it? We cannot get such dravyas frequently. Then the Acharya has made an formulation which can help in such situation. So they have selected the dravyas like Utpalanala, Mrunala, Padmotpala, Keshara, Palasha, Priyangu, Madhukadati, Yashtimadu, Asana dravyas. So these are certainly Rakta Pitta Hara, isn't it? We know it. Because of their Saumya and Shita Swabhav, they are Rakta Pitta Hara. So how to make it the Gratita Rakta Hara? So we need to use the Ushna and Tikshna Dravyas, which is not there in the they are not the property of Utpalanaladi because they are very Saumya. But it needs to be made Gratita Hara. Degradation of that Gratita Rakta, that coagulation of the clot is very much essential. So they made these Dravyas into Kshara, isn't it? When you make that Dravyas into Kshara, the Kshara property is Ksharanaha. So by being a Kshara, it will do the Ksharana of the Gratita Rakta. Being a Utpalanala, Mrunala, it will act as a Rakta Pitta Hara. And when you process Utpaladinam Agnidahat Shitatvam Apayatyeva, when you process it to Agni, the Shitatva that is present in Utpalanala is going to reduce so that it will not increase even Vata Kapha also. So there is a perfect treatment that can be mentioned here. The ksharas prepared out of these dravyas can be made. Kafanavande rudre sapitte kantagate shat krite prayogaha. When kantagata kritita rakta clot are there in the kanta, can go for the ksharas prepared out of these. And it is also mentioned that sakshaudram kritite rakte lihyat paravata shakra. The paravata chakra is with the sakshaudram. It's a very practical medicine, and many of the Vedas are using it, and many studies and even theses are being conducted on the paravata chakra for its anticoagulant property. So limited data suggests that most of the drugs I have mentioned or the acharyas have mentioned here are the anticoagulants. So to present in a nutshell, it is a complete Jwara chikitsa, Langana, Svedana, Yavagu, Tikta and Vamana in Navajwara. Can I have another 2 minutes? So Navajwara, in Navajwara, that is first to 7 days, Langana, Svedana, Yavagu, Tiktarasa and Vamana. But in Pachamana Jwara, from the 8th day to 12th day, Kashaya Pana, Pachana Kashaya if Ama dosha is still present, Shamana Kashaya if Pakwa doshas are there. And then in Pakwa Jwara, after 12 days, go for the Kashaya Pana if still Ama persists. If no Ama is there, go for the Kritapana and Kshirapana. If they doesn't work, go for the Shodhana, that is Vamana, Virechana, Astapana, Anuvasana, Vasya and Raktamoksha. And then Bahi Parimajana Chikitsa, Anjana, Dhuma, Kavala, Gandusha, Dhuma, Dhupana, Abhyanga, Parishaka and Ava. Coming to the Jwara Chikitsa Sutra, special reference to COVID-19, I can make, it is a Agantu Jwara. So no Ama will be there usually. So no Langana is necessary. If very less Agni is there, go for the Yoga, Yavagupana, Svedana, Tiktarasa, Kavala and Gandusha directly without going for the Langana. If Agni is still moderate in the beginning itself, without going for the Yavagupana also, you can directly go for the Kashaya Pana with Pachana and Shama. If Agni is perfect and Tikshna, go for the directly to the Kritapana even Kshirapana also. So if the COVID-19 presents with Upadravas, isn't it? If it presents with Swasakasa Pratishaya, Svedana, Yavagupana, Dhuma, and Swasakasa Chikitsa is to be administered. If it presents with Jwaratisara, Langana with Peyadikrama, Pachana Sangrahi Yavagu should be used, or else you can go for the Atisara Chikitsa Sutra also. Coagulopathies, Raktapitta with Vatakafa predominance, Rakta Prasadana, Pittara, Kshara, Putpalanaladi, and even Raktapitta Chikitsa needs to be indicated. Okay, so coming to the conclusions, Jwara Chikitsa is very precise. Thorough understanding of the Jwara Chikitsa Sutra will definitely give insights for the management of COVID-19, even for many other infectious fevers. COVID-19 with respiratory and gastrointestinal system involvement can also be managed with Jwara Chikitsa in mild and moderate cases. Clinical trials for the use of Ayurveda in complications of COVID-19 like coagulopathies needs to be undertaken. The studies and even practical models are needs to be undertaken to establish the evidences. This is all about the presentation I have given here. I thank our principal sir, all the organizing committee, and all the teaching faculty, and all my teachers who have guided me. And I also thank all the participants who have joined the online webinar. Thank you.
Dr. I thank Dr. Sidaram Guled sir for throwing light on current perspective of COVID-19 with help of Chikitsa Sutra of Jwara. Thank you, sir. Thank you once again. Now I welcome Dr. Ashwini Patil ma'am for the next session. Dr. Ashwini Patil ma'am, presently working as assistant professor in Government Ayurveda Medical College, Mysore. Ma'am is from Hubli, Karnataka. Ma'am finished her undergraduation from esteemed STM Ayurveda Medical College, Udupi. Ma'am finished her post-graduation from Ayurveda Mahavidyalaya, Hubli in the year 2017. Presently, ma'am is pursuing her PhD program under RGHS on the topic Conceptual and Applied Study on Indrasthana of Charak Samhita vis-a-vis presence of Purusha Ashrita Arishta Lakshanas in terminally ill subjects. So, ma'am is having 3 years of undergraduation and post-graduation teaching. Ma'am is awarded with Ma'am secured second rank in the university PG examinations in the year 2017. Uh, Ma'am is awarded with Best Paper Presentation Award at IF Expo 2014, conducted at Bangalore. And Ma'am is also received the award for Best Poster Presentation at OJAS 2020, conducted by JSS Ayurveda Medical College, Mysore, 2020. I welcome you, ma'am, for today's session. Over to you, ma'am.
Thank you, Dr. Rohit, for your warm welcome and introduction. Namaste to all the online viewers and listeners. So, I would like my topic for today's presentation is scope and application of Ayurvedic research in COVID-19. So, I would like to start my topic with the famous quotation from Charaka Vimanasthana, third chapter on Janapadodhamsa Adhyaya, where Charaka Acharya have said what is the cause for the utpatti of the Vyadhi. So in Satya Yuga, they said that there was no emergence of the disease. Then how the disease emerged? So they said that they have given the answer why the diseases are emerging, that too with the new outcomes. So he said, Yuge Yuge Dharmapada Kramena Anena Hiyate Gunapadascha Bhutanam Evam Lokaha Praliyate Samvatsara Shate Purnayati Samvatsara Kshayam देहिनाम् आयुषः काले यत्र यन्मान इष्यते इति विकाराणां प्रागुत्पत्ति हेतुरुक्तो भवति. So this is the hetu for the utpatti of the vikaras. So the answer is being given 1000 years ago. So the next question arises, is it applicable till today? Yes, it is applicable till today. Why? Because the Purusharthas which are being said in Ayurveda, the Dharma, Artha, Kama, Moksha, are heading towards the path of unrighteousness. The Roga, Arogya, Eka Karana, that is the Hina, Mithya, Ati Yoga of Indriyartha, Prajnaparada and Parinama, are exhibiting their Lakshana till today, which is having the impact on the health of the person. And that impact is causing for the new disease outbreak. So the previous shloka, whatever is being told, it is having its applicable till today. So the next question arises, what is the cause for these new disease outbreaks? So what is the cause for this? So which earth do you want to live in, a healthy or an unhealthy? So there exists only one planet Earth where the life exists. It is the only one planet. So when life exists, then many things do exist. And the present is not good as the past, and the future is going to be very, very worst. So what is the reason for this? And for all this reason, or the Mula Karana is the Adharma or the Prajnaparadha, what Acharyas have already been told. So while quoting the Hetu, Chakrapani quotes about the Sadharana Hetu and Asadharana Hetu. So what was the intention of taking earth is the Sadharana Hetu. That is, we all share the Vayu, Kala, Desha and the Jala, which is considered to be common to everyone. So once it gets vitiated, then the impact is the emergence of the new diseases what we are seeing. So where is the reference for all this? The reference is in Ayurveda, which everybody know what Ayurveda is. Ayurvindyati vidyate anena vayurvindati iti Ayurvedaha ayu sharira indriya sattvatma samyogaha. These are the definitions of Ayurveda. And the prayojana, it does not only cure the symptoms, it cures the soul, body and the mind. That is swastasya swasthya rakshana and aturasya vikara prashamana. So the next comes, what is 2020? So when I have taken this background for my topic, so now we are coming with the present situation. What is 2020? So 2020 was like a nightmare for all the humanity. So 2020 is nothing but COVID-19. So what is COVID-19? It is a contagious respiratory disease caused by the SARS coronavirus 2 viral infection, which is having a usual onset of 2 to 14 days and its duration is 5 days to 6 months. And its symptoms are fever, cough, fatigue, shortness of breath, and its complications are pneumonia, viral sepsis, kidney failure. How you are going to prevent it? Hand wash, face covering, social distancing. What is the treatment? Symptomatic and supportive. So with this background, let us enter into the subject. What does the future needs? So what we need, as always say that everybody likes to be health is wealth. So everybody at the end of the day say health is wealth. So what type of health we need? We need a health which is complete in the physical sphere, which is complete by the mental sphere, which is complete by the social sphere, and which is complete by the spiritual sphere. And what are the goals or the route to achieve it? That is by having a healthy diet, healthy lifestyle, and a healthy mental peace. So what is the approach to achieve such a health? How can we go for that approach? So when we want to go for that approach, so the National Institute of Health gave a wide strategic plan in July 2020 for COVID-19. They said that understand the disease. So which disease? The COVID disease. Try to prevent it, detect and treat, and mitigate. So this was their approach. The same approach acharyas have told whenever you are coming facing any new disease, how you are going to approach towards it. So understand first that disease. So how you are going to understand that disease? So he says, Vikaranam akushalo na jainiyat kadachit na hi sarva vikaranam namato asti dhruvastitihi. So if you are unable to name it, the names are given only for the vyavahara purpose. So when you are unable to identify or you are unable to name, then identify that particular disease based upon the dosha karana, based upon the dosha sthana, and based upon the dosha lakshana. So that is what understanding the disease. And how you are going to prevent it? So we know that in Ayurveda, Nidana Parivarjanameva, that is the first chikitsa. So that how you have already identified the Nidana, try to prevent it. So what we are doing, that is prevention through wearing the face mask, social distancing, etc. Then comes, once you have identified the disease, how you are going to detect and treat it. So there comes the Siddhanta of Upashaya and Anupashaya. So he says, Gudalingam Vyadhi Upashaya Anupashayabhyam Parikshet. So go for trial and error and try to go for, detect and treat the disease. Then comes the mitigate. So mitigate refers, it means to reduce the intensity of an effect. So how our treatment should be? So our treatment should be in such a that we have to reduce the intensity of an effect, and for that Charaka has told that how what should be our line of treatment or planning the treatment. Prayogah shamayed vyadhim yo anya udirayet na asav vishuddha shuddhastu shamayedya na kopayet. So treat or plan in such a way that don't cause for further complications and reduce the complications. So this is how you can go for understanding the disease, preventing that particular disease, detecting, treating, and then mitigating. So this should be the approach. Whatever new disease come or whatever new pandemics, endemics come, this should be our first approach of understanding that particular condition. So what walkaway we have to how to understand this? The walkaway for this is the research. So to understand, to mitigate, and to detect and treat, we have a walkway or path of research. So what research is being defined? So this definition is from Oxford Dictionary, which says that it's an endeavor. Endeavor means to achieve something, to discover new facts. So either discover new facts or correlate with the old facts. So you are having the data or you are having some text, you are going to correlate with that old facts. What is the way for that? By scientific study of a subject or a course of critical investigation. So this is how the research is being defined. And always research follows a scientific process. And this scientific process involves identifying the problem, clarifying the problem, determining how to collect the data for this problem, organizing the data, and interpreting the results. So this is one scientific approach or the process what the research is being designed or it is being employed. So the next question comes, what is the scope in Ayurveda for this research? So do we have any scope? Yes. So research is not a new thing in Ayurveda. So this research is being in Ayurveda, or it is being, Ayurveda is always stressed on investigation, on quest of knowledge, on probing the facts, on examination and documenting, lastly after verification. So always there was a scope or there is researches have been done in Ayurvedic literatures. So what could be our approach, or how we can do the Ayurvedic research? So we can employ, we have many classifications of research, like we have the qualitative research, quantitative research, and so on. The research goes on uh, increasing. So we can select a few which will fit into the scope of Ayurveda. So I have taken literary research or the fundamental research which we can have. Then we have the drug research, and then we have the clinical research. So based upon these three research, we can have the scope in our field. So going with the literary research. So the first base, so it is called as, the literary research is called as the base of all the research. Okay. It means, what does literary research means? It means finding something new within the literary work. So that is called as a literary research. So what is the scope of for this literary research, especially in our fraternity? So the scope is, we can revalidate our concepts through the research methodology. Whatever the siddhantas, the concepts are being told, those can be revalidated through the research, literary research. A proper interpretation rightly and for the verses as well as the shlokas is going to give an idea of what acharyas have told, or what is the hidden meaning of that particular verse. So that proper interpretation is also one of the scope of our literary research. And then analyzing that particular thing, that is also one of the scope. And then framing, what you are going to frame, a framing a neat workout, or framing a nidana panchaka, or framing the samprapti ghatakas is the scope for the literary research. Only when you properly understand the concepts, you interpret and analyze, then only a framing can be made. So all these literary research works can be collected from any of the Ayurvedic text or non-Ayurvedic text. We can refer the Vedas, Upanishads, catalogs, manuscripts, all these can be referred, and then framing work can be done where a proper path is being followed. And whenever we are framing here, there is a methodology for this literary research. That is, we have to go for the tantra, tantrartha, adhyayana, adhyayanartha, shabda, shabdartha, vakya, vakyartha. All this should be properly utilized, and then only a framing can be done. So how we can imply this literary research in at this present time of COVID? So we have the reference of Kasa. Look into the lakshanas of COVID-19. We have the reference of, we have Jwara, we have Swasa, we have Kasa, we have all the drugs also. So here, going back into our text, going back into or searching into our ancient text, it may be an Ayurvedic text or it may be any other sources from Vedas or the Upanishads, collect the information, try to interpret, try to analyze it, and form your a Nidana Panchaka or the Samprapti Ghatakas. So that becomes the scope during this time. So we don't want to give it a name as a COVID-19, or we don't want to say that our acharyas have not explained COVID-19. But our acharyas have explained about the Kasa, Shwasa, everything they have explained. Try to revalidate those concepts. So that becomes the scope of the literary research. So what is the limitation here? We too have limitations here. The first limitation, what we can tell is, nowadays research are more concentrated on clinical rather than the literary. So even though it is a base of the research, it has been neglecting much, and clinical research are developing very fast. The second comes is the availability. So whatever manuscripts or catalogs we are having now, it is all incomplete. So we are not having the availability of a complete manuscripts. So that is one of our limitation for our literary research. The next comes the lacunas. So lacunas not in the text or not in the scripts. The lacunas in understanding or interpreting ourselves, where we are unable to translate it from Sanskrit to English or English to Sanskrit. That is our lacuna, what we are finding in the literary research. And then the documentation. There is no proper documentation of the available manuscripts, or the incomplete manuscripts, or the one which are been discarded. So all these documentations are our limitations, which are not properly done. And lastly, the preservation. So the preservation also carries a very, very important role in protecting our vast or the literature. So here the preservation of the manuscripts is also one of our limitation, where the proper preservation is not being found. So this is the scope as well as the limitations of the literary. The next comes the drug research. So what is drug research here? So drug research, So it is as we all know that in Chikitsa Chatushpada, Acharyas have given the second importance to the Dravya, to the Bheshaja or the Aushadhi. So here, that is the importance. Even after literary, we are going with the drug research. So once the drug is available, we can go for the next research, that is the clinical research. So a chemical that a researcher analyzes or studied is called as a research drug or the drug research. So where this drug research is done, it is usually done in the laboratory or in the animals. After doing that only, it is being done on the human trials. So usually drug research undergoes 3 trials. That is, the first one is the drug discovery, the second one is the preclinical studies, and the third one is the clinical trials. So where do we stand in drug research? So what is the scope of this? So coming with the first point, that is the ganas. So all are well versed with the ganas. Everybody know that acharyas have given a plenty of information in the ganas only. And as Charaka says that sarvadravyam panchabhautikam, the scope enhances for drug research here. So we have many jivaniya ganas, brahmaniya ganas, krimigna, kasahara, shwasahara, jwarahara. So a research can be done in all these ganas to know its efficacy during this pandemic. The next comes the new drug research. So the new drug research should be done on the account of Rasa Panchaka principle. So whatever drug we are seeing or whatever the drugs we are studying, it is being written and documented many years ago. But we have never tried to add another new drug into this, or there is no any addition of the drug here based on the Rasa Panchaka principle. So this category can be taken as one of the form of the research. Less explained drugs. So there are some drugs which are less explained. So here we can take the example of the non-botanical drugs. So non-detailed drugs which are less explained. So in this case also we can go for a drug research where we are lacking with the research protocols. The next comes the common preparations widely used. So in some preparations or in many preparations, there are certain drugs which are commonly used. So those can be taken, and along with them, some additional combinations can be done, and that can be approached as one of the form of the drug research. And new combinations. So new combinations can also be done as one of the research protocol in the drug research. So now we have a combination of lakshanas in COVID-19 where there is Jwara, where there is Shwasa, where there is Kasa, where there is a reduction in the Vyadhikshamatva. So like this, we can select the drugs from these ganas and a new combination in a new form, that is either in Swarasa, Kalka, Kwata, Churna, any form can be done. So that comes under the new combinations. And when it comes with different parts and seasonal collection, so this is one of the contribution of our acharyas. So they have said according to the season, the different parts should be collected. So now this is the Hemanta Rutu, and everybody are aware that there is a rise or there will be a peak rise in the COVID-19. So here our research could be of helpful, where according to the part, if the drugs are selected and if they are processed and if they are taken as a tool for the research. For example, in this Rutu, Sushruta Acharya said Kshira should be collected, Charaka Acharya said Sara should be collected, and according to the Rajanighantu, the Kanda should be collected. So why can't we do like this? Why can't we take or we collect during this Rutu and prepare a drug and give it in the form of and try it as a trial? So this is what the different part and seasonal collection plays an important role in the drug research. So when I'm talking of all these, the most important background or the support for drug is a good collection, as said by the acharyas, a good preservation, and a manufacture. All these are part and parcel of the drug research. So here drug research, Acharya Charaka has given a very good explanation, or he has mentioned address to all the people of Ayurveda fraternity, saying that Na anaushadhi bhutam jagati kinchit dravyam upalabhyate. He said that, he has already said, don't sit into my collection or whatever I have written, because the entire universe is having the plants and all the plants are having the aushadhi guna. When all the plants are having the aushadhi guna, then he adds the second line as tam tam yukti artham. According to your yukti, try to collect it, try to preserve it, manufacture it, and try to do the research on this. Go for new drug research, go for new combinations. It is already been said, but we are not going, or we are not concentrating on that part of what our acharyas have told. So this is good collection, preservation, and manufacture. The next comes as a prevention in the unexposed cases also we can go for our drug research. Why? Because we can increase their immunity, and we can look into what our drugs are having the role in increasing their immunity, so that they, whenever they are not exposed to the COVID-19. And in all the old age and the children also, we have an option of doing this drug research. So this much we have the scope of drug research. Okay. The next comes, what are our limitations then? When we have so many scope, then there should be a limitation, isn't it? So that limitation comes in emergency conditions. So in emergency conditions, we cannot go for our drug trial. So in case of severe breathlessness, when they are having any renal failures or with comorbidities, in such emergency conditions, we are having our limitations. The next comes the drug efficacy and the drug standardization. So here the important point to be noticed, or according to me or my view, drug efficacy or standardization, our dravya or the drug, we don't have any such demarcation whether our dravya is acting at what level. Why? Because our dravya is going to act, we are having the crude form preparations, we are not extracting any synthetic material. When crude form preparation is there, we have the base of, or our methodology of drug research is what part you are going to use, what is the seasonal collection, what is the rasa panchaka, what is the panchabhautikata of that dravya, what is the prakriti of the person, what is the dosha pradhanata in that particular avastha of the disease. So we, our drugs are being told or being classified based on these parameters. We are not having, we are doing our drug research based on the parameters of the pharmacodynamics and the pharmacokinetics of the pharmacology. So here said is something, doing is something. So here the drug efficacy and drug standardization, we are having our limitations. So these are the two limitations what we are finding in our drug research. And the last comes is with the clinical research. So this is the important pathway to go, the clinical research. So what does clinical research is being defined? It determines the safety and effectiveness of the medicine, of the diagnostic tools and treatment regimens intended for the human safety. So this is clinical research. So all these parameters are looked before entering into the clinical research. So what is the scope of clinical research here in our fraternity? So clinical research is always done under trials. We have 4 phases of trials. Phase 1 trial includes 20 to 100 sample size, the number of subjects which you have to select. Phase 2 is 100 to 300, and phase 3 is 1000 to 3000, and phase 4 is always post-approval studies. So why I am telling this phase, we'll get to know in the later slides. So how we can apply this clinical research? We can apply this clinical research into 3 categories: as a preventive strategy, as a curative strategy, and a post-COVID management strategies. So preventive strategies, as I explained earlier, in the form of the unexposed cases or asymptomatic cases in the old age, in the children, we can go for the preventive strategies in the COVID. When we come for the curative strategies, we have to look into certain factors. So when we are going that, first we can see on the, based on the dosha, we have the curative strategies, that is the population. So here we can try our clinical research on the entire population along with the additional treatment. Along with the additional treatment is whatever the contemporary medicine is taking. Along with that, we can go for our treatment protocol. That is comes under your curative strategy under based on dosha, based on desha, and based on number of cases. Mild cases, moderate cases, we can go for our clinical clinical research. And then we can try our clinical research, or it can be done over the containment zone, cluster containment zone, whatever we had before the classification. Those all can be considered based on the desha. We can consider like this, we can divide and we can go for the curative strategies. Then comes based on kala. So here also we have a clinical research opportunity. So kala here refers to the Rutu. So as we have entered into the Hemanta Rutu, we can go for the research in the form of Rutucharya Abhyasa. As it is being told that in Hemanta Rutu especially, the Sharira Bala as well as the Agni Bala is Pradhana. There is a Kapha Sanchaya, there is a pitta prashamana avastha. So when whatever the rutucharya has been told here, the hemanta rutucharya, if we try to practice as a preventive measure, because clinical research we do in the form of intervention or the observational research, so either we can apply any of these two and we can go for the research based on the kala. So this is a peak time. We can start with our clinical research also, where we can prevent with the so-called peak to be rising in a COVID-19 in this November and December. So that is the based on kala. The next comes based on Rogi Bala as well as Roga Bala. So again here curative strategies comes under, depending upon the Roga Bala as well as the Rogi Bala, we can go for our clinical research. That is, if the person is old age, if they are having any comorbidities, if they are having any severe symptoms of the COVID-19, then and also on the Rogi Bala, we can go for the clinical research. And the last comes is with the based on sattva. See, we have seen many examples where a 99-year-old woman got cured completely with the COVID-19 and the youngsters reported with the death. So this is what nothing but the sattva. The sattva of the person plays a very, very important role to increase their vyadhi or decrease their vyadhi. So here we can try our sattva vajay chikitsa and have a clinical research part on this wing. So this is how we can go for the clinical research based upon these categories. And when we come with the post-COVID management strategies, that is whoever have been affected, for them to increase their vyadhi kshamatva, we can implement with the hita ahara, hita vihara, the dinacharya, the rutucharya, as well as the pathya concept. All that can be considered under the post-COVID management strategies. So this is how the research can be planned during this COVID-19. So these three can be applied and a research protocol can be framed. And what is the limitation of this clinical research? So the limitations comes, the first limitation is our legal issues. As all we are aware of the legal issues, we would not like to tell it elaborately. We are having certain legal issues which we have to come out so that we can do research in all the field, in all the clinical as well as in the drug as well as in the literaries. And phase 1 trial, as I said that phase 1 trial, even phase 1 trial is not been achieved by Ayurvedic people. 20 to 100 is the limitation, but we don't know where we stand in these 4 phases of the trial in clinical research. So this is one limitation what we are facing, and there is no integrated approach in treating any pandemics or the epidemics, or it may be any endemics. So these are the limitations what we are facing in our clinical research. So when we come to this, when we have seen all this research which have been done, this is the scope and limitations of Ayurvedic research in COVID-19. The next question arises, then from March till date, whether any Ayurvedic interventions have been done on COVID-19, whether do we have any data? Yes, we have data. So what is till date Ayurvedic research over COVID? So 58 Ayurveda interventions registered in CTIR, that is nothing but the Central Trial Registry of India. There 58 Ayurveda interventions have been registered from 1st March to 25th June, and under 58, 52 are interventional and 6 are observational studies. So this is registered. We are not known about whatever the trials are going. These are the registered interventions which we are getting from this data. The next comes a clinical trial done by a company called as Biogetica. So this, they manufactured 2 medicines called as Immunofree and Regimune. So they conducted by the permission of the CTRI only, and they conducted on moderate patients of COVID-19. And the clinical trial was done at Government Medical Hospital, Srikakulam, Andhra Pradesh, Parul Sevashram Hospital, Vadodara, Gujarat, and Lokamanya Hospital, Pune, Maharashtra. So what was the outcome of this clinical trial? See, over 85% of patients tested negative for coronavirus on day 5 when compared to 60% of patients undergoing conventional treatment. So this is clinical trial by Biogetica. Another clinical trial is being done by, or I think they are doing by Dalmia Healthcare, where they first gave their polyherbal combination called as Asta 15 for COVID-19. So it is a multi-center phase 3 clinical trial, but still the results are not yet out. The third, there was some opposition by the medical experts to two preparations. One was by coronil tablet by Patanjali Ayurveda, and another was the gingiver H from Pankaja Kasturi Herbals Private Limited. So this was opposed, and hence it is not being done. And the fourth one was Dr. Kajay's trial on Saumya and Agneya tablets, which was done on only 10 patients. So I stressed here phase 1 because it was only on 10 patients. So these are the Ayurvedic research which are done till date on COVID. And if you go with the modern trials, they are still trying or they are doing trials each and every day with HCQ, CQ, which has not been proven drugs till now. Azithromycin, which is considered as antibacterial, and they are treating for antiviral, and aspirin and symptomatic wise treatment. If it is fever, they are going with paracetamol. If they are cold and cough, they are going with antitussives. So this is how the treatments are going, and this is how our Ayurvedic treatments are going. So what does all this implies? So what is the need of the hour? So the need of the hour at this moment is two things we need to understand. Okay, we are not against with any of the medicine, or we are not against any of the protocols which are being tried over during this pandemic, but we need to understand something during this time. That's why I have given it as need of the hour. The first one is acceptance. What you have to accept? Accept Ayurveda as it is, accept dosha as it is, accept dhatu as it is, accept siddhantas as it is. Don't try to interpret or don't try to compare it with other things. So this is what our people or our fraternity needs. The acceptance is needed at this hour. The next thing comes science. Why science? So they say that science is nothing without an experiment. If so, then Ayurveda is called as science of life. Otherwise, it would have been called as philosophy of life. When it is being called as science of life, then experiment must have been done. Yes, experiments have been done through the Jnana Chakshusha. They are documented through Bahuvida Hetu and Pariksha, and trials were done. That's why data is being collected and being documented. So when you do the searching or when you do the researching, then only you are going to have the trials. When you have the trials, then only the data will be documented. Until it will not be documented. So you have two pictures over here. One is a glass filled with water, another is the ocean. So Ayurveda, don't fit this Ayurveda into the jar of contemporary medicine, it will spill out. Why? Because it is vast like an ocean with many of the hidden treasures. So let us implement Ayurvedic research through Ayurvedic methodologies so that we'll come out with a good outcome during all the pandemics, epidemics, endemics, and to any of the diseases which is going to come further. So everything is theoretically impossible until it is done. So our siddhantas, our dosha, dhatu seem to be impossible theoretically. Till what time they are impossible? Until it is done. So when you are going to do, when we are going to do these, when you are going to do with the research, when we are going with the clinical research, drug research and literary research, then only our theory is going to become possible. So my takeaway home message through this presentation is, let all the science go hand in hand for the sake of humanity. So I thank our principal, Dr. Gajanana Hegde sir, my HODs, Dr. Srivatsa sir and Dr. Chate sir, all my senior faculties, my colleagues, and Vishwa Ayurved Parishad for giving me this golden opportunity. Thank you one and all.
I thank Dr. Ashwini Patil ma'am for throwing light on scope and limitations of Ayurveda research in COVID-19 situation and updating our viewers on current research works. I thank today's speakers, Dr. Sidaram Guled sir and Dr. Ashwini Patil ma'am, on behalf of the organizing committee. So I thank all the viewers for staying tuned to TATVAPRABODHINI. We will be back tomorrow on day 5 of TATVAPRABODHINI with 8th and 9th scientific sessions by Dr. Suman, Dr. Anurupa, Dr. Shilpa, and Dr. Mohan Kumari ma'am. So stay tuned to TATVAPRABODHINI. Thank you.